paused it earlier. Thank you. All right, let's shake it up and start again. Hello, everybody. Good morning, good afternoon. I'm Melissa Cleater, Program Manager at the National Fund. I am thrilled that you're here to join us for the second of this amazing series, the Frontline Focused, Building an Equitable and Thriving Workplace. A quick thank you to our generous partners for supporting this series, West Miriam Assessment Foundation, MetLife Foundation, and Futures Without Violence. Here is a preview of what we're going to cover today. I will give a very brief overview of the National Fund and Career Stat for folks who are new to the network. Rebecca Neuwirth from Upwardly Global will share an overview of their work and the U.S. immigrant and refugee landscape. Then Tamar Forlichstein-Appel, also with Upwardly Global, will dive into relicensing details and give us a few insights with some case studies. And then typically at 2 p.m., we would go into these optional breakout rooms for a little bit of peer-to-peer connection. But I think given our late start, those are going to be truncated today. So we will find other ways to continue the conversation as we go through the content today. So thank you again, to shout out to everyone who attended our first launch few weeks ago, and for your patience while I dive into this content that you are familiar with. This is a great time, if you haven't already, to do a little roll call in the chat with your name, organization, and location. But if this is your first time joining a Career Stat webinar, please pay attention as I give this little overview. The National Fund supports a network of over 30 regional workforce collaboratives aligned around a vision of workforce equity. We have these three big goals where workers have the resources required to thrive, race does not dictate employment outcomes, and all jobs are good jobs. Not to be confused with any job is a good job, it's that all jobs are good jobs. And we organize this work around 4 integrated solutions. This is the Activate Employer team. We work very closely with our colleagues in Equip Workers for Success, Systems Changed, and Co-Investment. CareerStat is a cornerstone of the Activate Employers work. It is an employer-driven network based on peer exchange created to increase the investment in the skills and careers of frontline healthcare workers. And just to be clear, when we're talking about frontline healthcare workers, we're referring to those positions that require an associate's degree or less, or make less than $50,000 a year. So this includes many patient-facing roles or allied health roles that are critical to building the nursing pipeline. But it also includes role in transport, dietary services, administration, and environmental services. The National Career Stat Network has over 320 members across 38 states, and that includes a range of healthcare employers across the continuum of care. It also includes partner organizations like industry partnerships, workforce development partners, and philanthropic organizations. And then this is just a quick level set on the purpose of this series. We are always interested in learning and sharing those best practices to engage underserved and untapped talent and to address workforce challenges. Always want to connect with peers. This helps validate your experience. It inspires folks to hear what other people are doing with similar challenges in different regions. And then we're also here to shift mindsets and practices and approaches to meet the moment. In the previous webinar, we talked about how the long-term systemic staffing challenges in the healthcare sector were elevated rather than created by the pandemic. And long-term strategies like building more equitable and inclusive workplaces offer systems a competitive advantage in recruiting and retaining staff, especially when we looked at the labor market data on who is available to fill those high demand roles. And if you missed the previous presentation, it is available. We'll put a link in the chat, perhaps on your next lunch hour. If you're looking for a little background, you could watch that recording. But one area of untapped talent that we talked about is immigrant and refugees. They possess needed knowledge and skills to fill these positions, but they also create numerous legal and cultural barriers to the workforce. And the goal of this session is to share some insight and examples to spark creativity and action on how you might address these barriers in your community. So as always, I encourage folks to be curious and active. All of you on the line have valuable and important experience and expertise to contribute to this conversation. So I encourage you to do that, whether that's in the chat or later. It's your questions, your experience, all are welcome. And then, bless us for trying something else with technology, but we're going to try it and see how it goes. This is a little starter for us. Before we get started, we want to hear from you. So if you could go in another browser or on your phone or your tablet to menti.com, that's MENTI.com. And once you get there, you'll be asked for a code. And the code you should enter is 3854. And then you'll be prompted to share the top 3 critical to hire positions in your organizations, or if you're a workforce partner, what are the top 3 positions that you're constantly hearing about from your healthcare employer partners? And so now will be our big test to see if anything is happening. It should be creating a word cloud as folks start entering. So again, you want to go to menti.com. Oh, the passcode is, oh, Lord have mercy. It is 38548578. There's a whole nother 4 numbers that I did not share. My apologies. So you'll want to enter the code 38548578. And let's see, and we can always come back to this. I don't want us to be awkwardly waiting for our beautiful word cloud. But if you have that opportunity, we would love to get some insight on where those positions are for you that you're looking to recruit. Oh, it's happening. Oh, thank you so much. And just know that when you see the size of these positions, the ones that are mentioned more frequently are going to be a little bit larger in the word cloud than others. But we have, as is classic, we have nurses, we have RNs, we have RN. We have multiple ways of talking about the same position. But we have lots of different things here: surge techs, medical assistants. Pharmacy techs are social workers in great need. So this is fantastic. Please keep them coming. But without further ado, I am going to pass it over to our presenters. If I can get to the next slide. Why? Okay, let's try. Aha, here we go. Perfect. All right, so without further ado, Rebecca, please take it away.
Thank you so much. What a great session. I'm so appreciative to see everybody introducing themselves, and Melissa and Tom and Alex for your work. I think it's inspirational that you're doing this, and incredibly timely. So we're also really thrilled at Upwardly Global to be able to share what we think some of the critical solutions are to the healthcare, the gap in skilled labor for healthcare needs, and also how we can help the healthcare system to reach people who are currently being underserved by our existing systems. And we actually think that that solution, at least in part, might be one and the same. So I'm going to share a little bit about who we are. First of all, I'm Rebecca, as Melissa said. I'm based in New York City. Upwardly Global, where I serve as the Executive Vice President, is a national organization We were founded about 23 years ago now, and we have boots on the ground, so to speak, in 4 different parts of the country, but we are working right now in over 19 states and quickly expanding as we support field building around this issue. So I'm in our New York office, Tamar is in our Chicago office. We also have an office in San Francisco and in what we call the DMV area. I saw where many of you come from: Ohio, Massachusetts, Vermont, some from upstate New York. So we often are working with people or with other organizations that are doing the type of work that we're doing, and we're providing technical assistance in order to support them in some of those locations as well. The goal of Upwardly Global, and we were really founded as the first organization to do this work, basically was to be able to understand when immigrants and refugees come into our country, they are traditionally thrown into what we call rapid attachment jobs, which means just do something so that they're working. And those rapid attachment jobs, and we understand the why of that, are very often not in any way correlated to the education and the skills that they bring into the country. The goal of Upwardly Global, when we were founded and to this day, is to build a much stronger system where we're able to recognize and prize the fact that folks who are coming to this country actually are, over 50% of them have at least a BA. Many of them have very significant educational background and very significant professional experience. And we should ideally be able to utilize that. And it is a win-win if we do it right. It's a win for them when you come to a new country, having left everything behind, to have your experience and your education recognized is, the critical pathway to feeling dignity and belonging in your new home. And of course, allows many people to step into roles that are much better and that pay better and that allow them to support their families and their communities. And it's a win for our country too, because we have labor shortages, as all of you know, and because these are folks who could be plugged in really meaningful ways to fill those roles and help us to fill, the jobs report just showed 11 million open jobs, many in the mid and high skill sectors. So a little bit about who our job seekers are. Who are we working with? Currently, we're working with folks from really almost all over. We do have a preponderance at the moment of refugees from Afghanistan. A lot of our work meets the moment that we read in the newspaper. It's not a surprise because we've been reading about what's happening in Afghanistan. And of course, the US government accepted many people who were fleeing the hardship there and who had worked really closely with the US and therefore whose lives were directly endangered by staying there. So we're working with a lot of refugees right now from Afghanistan. We're seeing increasing numbers of people from Ukraine also applying to be part of our job, from Venezuela, from Haiti, from Nicaragua, and that tracks, like I said, our current events in the world and migration patterns broadly. But we also see people truly from across the world. A lot of our people, I should add, are many people, this speaks a little bit about age. So, the folks that we work with, some of them are young, but many of them are mid-career. They bring, like I said, a lot of experience and a lot of education to the table. The average job seeker has 5 to 7 years of professional experience, so really substantial. And when we help to place people, we're usually putting them in jobs with an average annual salary of about $67,000. That's considered a wage that allows you to support your family and community, and we're very proud to be able to do that. On the left, there are a few stats about the backgrounds of our folks, and you see about 10% of the people that we work with directly have a deep healthcare background. But what we've also found is that a lot of healthcare needs span other roles. Like we're placing a lot of people with accounting and finance backgrounds into healthcare positions, or with technology backgrounds like cybersecurity into healthcare roles. So there's a lot of movability, so to speak, in that field. This speaks a little bit about how we work, so I'll speak about it briefly. But as an organization, our primary role at the center of everything we do is working with immigrant and refugee professionals and helping them to find roles that meet the skill sets that they bring to the country. In order to do that, we are deeply building partnerships with other organizations that are at the front lines of receiving refugees and immigrants when they come in. And we're working very, very closely as well with employers like you guys to try to figure out how can we build those matches? How can we help you to evaluate and understand the backgrounds that newcomers bring so that we can make matches that are generative and mutually supportive? Just a little bit more about some of sort of the key issues that we're seeing in 2023. First of all, we are seeing, as I'm sure you are as well, just this incredible bump in the use of technology across the board. For us, that has a few implications. Number one, all of the people that we work with have deep digital skills, and we continue to support them in building on existing skills that they have in the digital space so that they are deeply digitally literate. That feels like a baseline for being able to get mid-skill jobs in the United States, including in the healthcare field. Number two, there's a lot of really exciting stuff out there around AI. And I think one of the most exciting ideas is how can we use AI not to supplant human beings, but to help us do the stuff that humans were never that great at in the first place. And making workforce matches is one of those areas. Anyone who's been on the job search knows you're kind of out there as an individual trying to figure out, how do I market myself? How do I figure out what roles are open? How do I apply for this and that? Figuring out how to do that matchmaking between skills people have and skills that roles need is a function that we think AI may be able to support very substantially. And so we're doing some really, I'd say, cutting edge experimentation with how we can use tools that would allow us to make matches and how we can use the human piece of career coaching and connection to its best effect as well, which really comes with the helping people to understand and build support and personal strength in their job search. And similarly, helping employers to step back and understand what the opportunities are and helping them to think differently about their recruitment and hiring processes and about what it means to retain and support people who come from diverse backgrounds. We're also doing a deep dive this year into what it means to help women in particular go back into the workplace. As you all know, during COVID, there was a huge drop-off of women in the workplace. And our immigrant and refugee population is about 50% women, and they are especially burdened by all the things that are challenges of women across the board, but even more so when you are new to a country, very isolated, and usually living in poverty. And so we're doing a deep dive into women in the workplace, like I said, and we're really thinking deeply about the role of technology as well, because we're seeing, as you are too, all these big tech companies laying people off, but at the same time, every company, every healthcare agency, every nonprofit even needing to build its technology capability. And so that's a space where we think we need to lean in thoughtfully. Finally, there's a lot of movement sort of on the, and actually this goes into that, there's a lot of movement on the policy front around these issues, largely because immigrants and refugees have become such a sort of highly politicized, I think, unfortunately, issue. I think what our work does is try to drill down the tone here. In fact, immigrants and refugees should not be seen as being a burden to our country. They are first and foremost a solution to substantial economic and labor force issues that we have. And we think that that frame helps us to relook at the issue of immigration in a really net positive way. And by the way, what I found very interesting is that countries like Canada, Korea, South Korea, Japan, in a much more sophisticated, Germany, in a much more sophisticated way, are understanding that there are labor market issues and also demographic issues that are really meaningfully impacting the future of work, and that immigrants and refugees and increased migration in this world could be part of the solution. And the US is a little bit behind on this, and the politicization of immigrants and refugees is not supportive of this. And so the frame that we're offering, I think, is critically important for the work that we're doing and also for the country as a whole. Okay, I wanted to talk now more grassroots, more really hands-on about what are the barriers and challenges that immigrants and refugees who come to the country, let's say with healthcare backgrounds, face in order to be able to place into jobs that they can do, but that they are often not tapped for. And this slide shows a few of the critical ones. Number one, job search strategy writ large. So I want to step back. What does that mean? That means when you come to this country, let's say you're a doctor from Nigeria with substantial experience in Ebola, and you see that there's a pandemic going on that you can meaningfully contribute your knowledge and experience to. It's extremely difficult to understand, though, where is your pathway forward to be able to support medical and healthcare needs in this country. So the first thing that Upwardly Global is trying to do is simply help people figure out what are your options, where could you go, and what are the potential pathways, and what is it going to mean for you to follow them. Number two, and very apropos for this conversation, is the lack of licenses and certifications, US licenses and certifications. In the medical field, that is a highly complex, and we will dive into this deeper in this conversation, not at all transparent process. Each state has its own thing going on as well to make it even more complex for folks. Number three, English language proficiency. All the people that we work with have actually fairly strong English language proficiency, but they often have accents. For employers, that's a barrier, believe it or not, to this day, substantially. And sometimes even when they speak strong English, their professional English is not quite adopted to US professional English norms. And so a piece of our work has to do with supporting people's professional English competence, especially with an industry focus. Gaps in resume, that's an obvious one, but if you are a refugee from another country who has had to leave everything behind and completely upend your family and resettle them, you're going to have a gap in your resume. If, on the other hand, as an employer, you are relying on an AI system that automatically pulls out people who have gaps in their resumes, which is the norm today, you're going to be automatically, before any human being even comes into contact, you're going to be automatically disqualifying, technically, potentially millions of people who could qualify for a job, but who won't. Lack of professional networks. 85% of us get our jobs through some level or degree of someone who knows someone who knows someone and a warm introduction. If you are new to this country, you are not part of those professional networks, those college networks, those camp networks, those school networks that each of us relies on. And so that's another place where we are deeply supporting people and working with employers to do that. And finally, issues of timing for folks who are working often survival jobs. Like the typical person that we would work with is a doctor from overseas who's driving a Lyft right now in order to survive, but who is eager to try to figure out how to get back into his or her field, and looking for the time and support to be able to do that. And finally, employer bias, which is some of what we've spoken about. A lot of times that's unconscious. Sometimes it's based on AI systems that are biased for us. But one of the very important things that we're doing, and I hope this presentation will help support, is helping employers to think differently about where talent might sit and how they might be able to look in a different way and work with groups like ours to support that process so that it is deeply successful for employers as well and meets their needs. Very briefly, The Minneapolis Federal Reserve has done a deep dive, and I see some of you are from Minnesota, so this may be of specific interest. That's a wonderful Federal Reserve, and we're working really closely with them on this issue of immigrant and refugee talent. They have done a study recently on licensing, and I thought it might be interesting for this group to just look at some of their top level findings. Yeah, I think one thing that they have found in the study is that in general, workers of color are much less likely to be licensed. And that includes the immigrants and refugees that we're working with, not all of them, but about 75% of them are immigrants and refugees with intersectional identities, including self-identification as being people of color. And then foreign-born workers who have more than a bachelor's degree experience the largest licensure disparities. And that, again, is for all the reasons that we're speaking of. So the Federal Reserve has a mandate, as does CareerStat, to support diverse people finding good jobs. And they have identified immigrants and refugees as being a critical constituency, and specifically around the issue of licensing barriers. Yeah, what are some of the improvement strategies that would help us to address these issues? I think I might turn it over at this point to Tamar, who can throw it right back at me if she wants later. Does that sound good, Tamar?
Sure, happy to talk about it. So we will dive in more to this idea of improving recognition of foreign training. Having looked at your word cloud and thinking a lot about the demand in healthcare, I think a lot of what I think about are pathways and opportunities to support. So supporting and promoting navigation programs. I think to hold in your mind that to bring an internationally trained doctor onto your staff with the idea that you'll bring them in as a medical assistant, but then you will figure out ways to utilize more of their training, more of their experience, and help them to find a way to move into that more family supportive professional level is really, really an essential piece. And I love at the beginning, Melissa talked about the creativity. So we love to partner with organizations and recruiters that are really willing to be creative and make these investments based on our knowledge that there is so much high demand in this field. And I think we are going to show a brief video at this point of a story of one of our job seekers.
We can't hear the sound.
We can also, if it doesn't work, share the link and circle back.
No.
Usually you have to select to share the volume as you're sharing the link. I don't know if that happened. Because we still
Are you not hearing it at all?
No.
Okay.
We can talk about it, Jackie. Perhaps that's easier. Yes, you're right. There's something Zoom that enables the volume, I think.
So we are happy to share this video. We have a whole series of great videos and stories on our website. Jackie is a doctor from Haiti who came to the US, was living in poverty in New York, found our program. Rebecca, I think you know Jackie, so maybe I'll pass this to you.
Yeah, I love Jackie. I mean, actually, it's hard to meet our job seekers and not to feel very strongly about them. Tamar herself has helped over 500 incredible people into jobs that fit their skills and into a new life in the United States. So I think it's always worthwhile touting the people who are doing the work every day and how much it means to them. But Jackie is someone who I've had a chance to meet. He lives in New York City. He was a doctor in Haiti, as was his wife, a pediatrician. They have a beautiful little daughter. He was politically active and sought asylum in the United States. And actually, he and his wife and daughter were living in a homeless shelter in New York City while he desperately tried to figure out how to get back into the medical field. He studied while he was doing sort of a day job for survival. He was studying to take these exams that would qualify him to be able to relicense as a doctor, which is a very, very long process. And Upwardly Global started to work with him. We started an incredible program, which we'll talk about in a moment more, with New York Presbyterian Hospital, which is one of the major hospital systems in New York. They employ over 40,000 people and have a lot of hospitals and a lot of clinics right now. And New York Presbyterian started to work with us to build these paid internship opportunities where folks like Jackie could come in, usually in situations where they were actually overqualified for the positions, but filling needs and through their additional knowledge, able to be quite additive in those positions. And Jackie got one of those positions. He was offered then a full-time job in a role that's not clinical, which he accepted and took and served. And then he is now going on to do his residency, and he will be a full-fledged doctor. And I think his wife is finally able to start soon now too, that they have a stable source of income and also a place to live with their daughter. So he's just an example of one of the many, many extraordinary people who, come to this country and try to figure out how can they plug in the skills and the passion that they have for the work that they're doing. And that makes up such a big part of their identity as it does ours in this country in a way that's actually meaningful. And he's a very special person. So just one of 165,000 medically trained people, immigrants and refugees in this country who are not able to work in their fields right now. So that is sort of the sum total of opportunity here when we think about filling needed roles.
Should I jump? You go.
Okay, I'll just do this slide, then I'll pass it back to you. This is a little bit about, all the jobs that are available. Today, this slide is slightly outdated, but I think that these numbers are still largely accurate. And I bet you guys are much more the experts on this than we are. We were just looking for where healthcare jobs existed in some of the areas where we're working, and found, really extraordinary numbers, and therefore an extraordinary opportunity for us to match talent with need. The next slide shows
Rebecca, I'm so sorry. I'm just going to jump in with a question here from the chat that asked if you could tell how Jackie got connected to the U.S. residency program.
Sure, yeah. Yes, we support. So Upwardly Global, and actually Tamar is, the head of we have a series of a number of coaches who focus on key industries where there's opportunity, one of which is healthcare. Tamar is the head of that group, and she herself is also a coach. So actually, Jackie was working with one of our other colleagues, and our colleague really, and that's what Upwardly Global does. We work step by step with folks like Jackie to try to figure out what are the opportunities that they have. Like I said, his first opportunity was in an alternative pathway through New York Presbyterian, where he though got a very well-paid internship. It was paying $65,000 a year, and then got a job. And then as he decided to go into residency, he was supported by Upwardly Global in those applications. And, he happily matched. We just had match day, as all of you know. And I know Tamar had been helping, dozens of people through that match process. And we were very happy to see that many of them placed. But as you may also know, if you are foreign born, it is especially difficult to place. So that additional help is absolutely critical in terms of the application process. And even with it, not everybody places who is deserving of placement. And that's where alternative opportunities are meaningful, and also where some of the policy work that we're stepping into to try to open up easier pathways to being relicensed comes in. Does that help answer the question?
We will definitely dive into it some more. Joy, I think absolutely. That is the problem. There are not enough residency spots. And I'll talk a little bit about the process for those who don't know it. But whereas Upwardly Global came up with the idea, our founder, Jane Liu, that if a person was an accountant or an IT professional or a marketer in their country of origin, they should be able to bring those skills, that training and experience, and work in the US. We all know that the healthcare field is so highly regulated that we meet, many more barriers, which is why we have really leaned into identifying these various pathways, and as Rebecca said, doing some advocacy and work around alternative licensing. So I'll talk briefly about these three pathways that we've identified. I've been at UpGlow for almost 10 years now, and really has taken a long time for me to be able to articulate very clearly how we do this work and how we support people. That being said, for lots of our job seekers, as you might imagine, as they're literally getting off planes from Afghanistan or Ukraine, this can be a really complicated, confusing period. And for them, their individual pathways may not be as clear, but we work with them, we support them, we coach them, and provide some great resources to help them pursue, possibly more than one of these pathways. Oftentimes, the first thing we look at is potentially either a career pivot or a short-term pivot, because we know that they need to support themselves and their families. They need to work. Working at Walmart, driving Uber or Lyft is not a family sustaining wage, and it's not utilizing their training. So we look at their experience, their passion. For many of them, clinical research can be a great pathway, which is less regulated, builds on their clinical skills. We've identified some training resources. I'll talk a little bit more about our reskilling. We also know many of these folks come with extensive, high-level public health experience. I work with a number of people who were incredibly meaningful leaders in their countries of origin, in the health systems, in the ministries of health and the health departments. Unfortunately, for many of them, being leaders put them oftentimes at odds with the politics as that changed. And so as they come here, helping them identify pathways into public health, how we support them, how we navigate with them, how we help them build those skills and networks is so essential. So one way is looking at those pivots. One opportunity is relicensing. So we know the process, I'm going to go a little more into detail, is very expensive and time consuming. For some people, it is absolutely the right pathway. We are not medical professionals, but we know in that process, building connections in the medical field is essential. So helping to coach them to build those connections, to get those oftentimes more preliminary jobs that will help them to learn about the US system, to bring their experience and skills. One of the things we do around relicensing, we just started a program where we help the folks who who are applying to do interview practice. We know in many countries in the world, if you get yourself into the right school program, be that as a lawyer or a doctor or an engineer, interviewing is sort of an afterthought, but in the American system, it is essential. So a lot of our work is with these folks who have been able to move professionally without doing a US style interview, where really communication skills, eye contact, talking about yourself, which is very, very cultural, it can be really challenging. So I'm really excited about this mock interview program we presented, and having really great results this year. So licensing is a pathway for some people. We are also working, as Rebecca said, in a number of states to explore opportunities for alternative licensing. I'll also dive a little more into that. It involves having leaders at the state level, be that legislators, licensing bodies, to come together, to look at legislation, to think about how to help create programs that will allow the folks that we have welcomed into our country as refugees, as asylees, as immigrants, be that family reunification, be that the green card lottery. We've said, we want you here. We give you work permits. Now, how can we help you transition into the jobs that you come with skills and training to do? So helping employers and legislators and licensing bodies to really think creatively to address this need. So we see that we are part of a partnership. Nope, perfect. With a number of with state level groups. We work with the World Education Services. WES does a lot of advocacy and leadership in this space, and we are working. We know Washington State has a new alternative license for doctors. Colorado's creating a program. Massachusetts has something. Oregon, Idaho, Utah, Arizona, Nevada, Tennessee, and Illinois, which I will talk about just briefly, because it was been a great experience working with our national partners. You can go to the next slide, I think mentions the Illinois. So we know that there's a lot, that at least 6,000 internationally trained healthcare workers in Illinois who aren't utilized. We've looked at job listings. We've seen, we know that the demand is here. The demand is significant for primary care, pediatricians, OBGYN, and for sure internists, and that we know our job seekers want to contribute. They wanted to contribute during the pandemic. We did a survey, and we really we understood, we understand from working with them that there is so much interest in being part of the solution, being part of the process. And so we were very lucky in Illinois. One of our local leaders of our leadership council had a connection to a state legislator who's very involved in immigrant issues, and also sits on the healthcare licensing committee. And we're starting a process to look at how we can create a limited license in Illinois, provide clinical readiness for our internationally trained doctors, and also, have more advocacy within the state. So we're looking at creating a ombudsman who would work for the licensing department, the IDFPR, and really be able to help support these people through the process. So a really exciting time, lots of this happening in lots of states. If you have questions about what's going on where you are, we're happy to connect with you, happy to connect you to our friends at WES who are really have a strong leadership in the advocacy space, and really partner with groups like us who are doing the work on the ground, who can bring the people to tell the stories.
Yeah. Here, I'm going to jump in here, I think, just to move us through, and then I'll hand it back to Tamar. But basically, this piece of the presentation, I think, is the most relevant for you guys. Tamar just spoke about alternative licensing, which is a policy thing that needs to happen. But it is critically important to have employers in states saying, hey, we need these people. Let's get this licensing process to be simplified for folks who have the qualifications so that we can plug them in so that they can support real needs on the ground. So your voices on that are critical, truly critical. And Upwardly Global is involved not because we're a policy shop, actually, but because we have these incredibly qualified people who find themselves stymied in their ability to get back into the profession because of these very restrictive, unnecessarily restrictive licensing laws. We all care about quality, but we don't need to be punishing and make it virtually impossible for many people to be able to relicense. The second opportunity, so that's a policy opportunity where we see employers playing a key role. The second opportunity is really around this career pivots idea. And our partnership with New York Presbyterian, I think, is a model here. And we would welcome other healthcare providers replicating this program. And I hope Career Stats will do something more on this along with the New York Pres folks. But top level, New York Presbyterian, like I said, 40,000 people employed in New York, massive healthcare needs, understands that we have people who are qualified to support them. And even without being able to plug folks into clinical roles, saw that they had a lot of other needs that could be filled by these very highly qualified individuals. And so they opened a paid internship and then they worked with us to be able to identify people who could play roles. And they worked very closely with the folks that we've been able to put into positions and have ended up hiring many of them for permanent roles. I love this model because I think an internship program is kind of a low bar to be able to do. You can bring people in, you can see them, you can see how they fit into the culture, how they bring their qualities to the table. And then after that, there's the opportunity to hire. Like I said, we saw many of the people who had been plugged into internships getting full-time roles. And that's, of course, a win-win-win for everyone. But it takes a little bit of imagination. And New York Presbyterian showed that they were able to do that. And we're expanding our work with them in very meaningful ways. And I think that they have been more than thrilled by the people who have joined their team because of this. The next slide goes into more detail on this. I think we'll skip over this for time's sake, but I think James asked up front whether you can have this slide deck, and if Melissa is willing to share it with you, we're very happy for you to have it, and also very happy to engage with you if you're interested in moving any of this forward or have questions about how it might be done. I'm going to throw it back to you now, Tamar. That's okay.
Sure. So one of the things we learned over the course, we've learned over the course of our work, but we really leaned into during the pandemic was the interested in upskilling and reskilling and helping our job seekers meet the needs of the employers that we work with, and to know how to help and support. So we have a wonderful, wonderful menu of programs and partnerships. Some general training. Coursera is offered free to our job seekers with a whole, university, international universities access. We partner with Udemy, with Google, and Salesforce for training. In the healthcare space, we've been really excited to have a subscription to CITI program, which helps train clinical research coordinators and other research professionals. And we've been offering that to our job seekers to help with the pivot. We know there are lots of folks out there trying to sell education and courses, and they're scams. I was just talking to one of my colleagues who works in IT. There are so many boot camps out there that are low quality, where people are taking advantage of this community. So we really work with employers, with our job seekers, and with training providers to understand where the opportunities and the high quality skilling can happen to help people advance. We know, based on research done by the Migration Policy Institute, that it is not that folks need US degrees, but often having a certificate that's well known in the field can really help them. So that's an area that we are really excited about. We're looking to build our partnerships. We're meeting this week or next with the National Health Career Association to see if there are opportunities to help some of our healthcare professionals get some of those entry-level certifications so that they could get jobs in the field. If you're working at Walmart, I have a nurse in Houston who's working in Walmart. He wants to be in a hospital. They're very willing to start. They know that starting as a medical assistant or a nursing assistant will get them on the path. What we get frustrated is to spend a lot of time and money to get a certification for skill when your skills are much beyond that. So how do we creatively help these folks get the certifications, get their training and experience recognized so that they can move into clinics and hospitals? So we're doing a lot of work in upskilling and reskilling and thinking about how to help support our folks get into your systems so that they can be contributing to those positions where you all have so much demand and need. So I mentioned some of the specifics, the CITI program. We also have a Google program, which we offer with Coursera on project management, data analytics. A lot of our folks do come with research or data skills, but it's great then to build on that and get these certifications. I talked a little bit about allied health area to bridge them into healthcare jobs. And we have a very small scholarship program where we're trying to figure out how to utilize, small scholarships to help create those opportunities for our folks. And always looking for more ideas and partners to do this work to get people on the pathway. I want to give a little overview of the licensing processes for doctors and nurses. I know someone earlier asked. So for doctors, the program is managed through the ECFMG, which is the Educational Commission for Foreign Medical Grads. They have to take all the United States medical licensing exams, USMLEs, as a US student. Oftentimes they meet challenges because there's a need for US clinical experience. So if you're in medical school in the US, you do a series of rotations and get this clinical experience, but our folks don't have access to that. So one of the things we're looking at the state of Minnesota has a great program to provide. They partner with the University of Minnesota to provide some clinical experience. I'm partnering with one of my alumni, a doctor from Turkey who's now working at University of Connecticut, and they're interested in maybe creating a program with us for clinical experience. So we're really drilling into that space now. I think I talked a little bit earlier about the coaching we give to our folks, but we're cognizant that there's simply not enough residency spots. So US grads typically place at 90 to 95%. International medical grads compete with US grads, and their match rate is more in the 50s. So this process is expensive and time consuming. And as I mentioned, there's a need for US clinical experience. There is a need for letters of recommendation from US doctors. So anytime, you know, our folks can get an opportunity to work in a clinical setting. I have doctors who are working as surgical assistants now. I have doctors working as medical assistants, doing research, all of that, both to build their skills, but also to build those networks. Conversely, nursing is a bit more of a straightforward process, although each state has its own licensing process. There's less of an evaluation of their clinical work, so they don't have to have that US experience. They have to have their degree evaluated. Each state has a different series of companies that they allow the evaluation to come from. Many states do English assessments. The exam that nurses take is the NCLEX. It's more straightforward. It's also much more affordable, less time consuming. That being said, lots of folks in that process need some support. You know, we would love to partner with folks who would bring our nurses on as nursing assistants and train them and help them get that experience in the US context that would prepare them for NCLEX. So very glad that Rebecca shared my email. I'm willing to talk to anyone who's got ideas in this space. You know, the demand for nurses is huge. We know that internationally trained nurses won't meet all the demand in our country, but they certainly could meet a part of that. I also work with many doctors who would pivot from doctors to nurses. They say, well, can I take the exam? And I say, nope, you have to be trained as a nurse in the US. They look at the cost of nursing school and they're done. They can't afford it. Wouldn't it be a gift to our country to start some programs where these doctors could be working in healthcare and training to meet the US nursing licensing requirements while they're working, while they're supporting their families? I'm working with an amazing Afghan doctor in Pennsylvania. He's supporting a family. I think he has 3 kids, needs to be working. He's getting ready to send his kids to college. He cannot afford to go back to school and start from scratch when he has skills and experience. So I just want to encourage you all to think how you can in your hospital, clinic, state, utilize these amazing professionals to meet some of your needs. You know, we want to see more opportunities. We're so excited about the New York Presbyterian model. We're starting to try to replicate that with some partnerships in Texas and the DC area. You know, we know these people need to build their experience and they need opportunities. They're willing to work in allied health. They're willing to take a step back. Oftentimes they have to support their families and they have to feel like they're on a pathway. So if there's a program where they can start as some sort of tech and then build towards the careers that they had, that would be amazing. And I really want to encourage everyone to think creatively, to get to know the resources in their community. Every community has an organization that's supporting refugees and immigrants, that's doing refugee resettlement, and to think as a community, as a country, how we can really meet these hiring needs. So as we finish up, I want you to remember licensing happens at the state level. As we said, we're part of a national coalition. There's work going on in many states to look at creating new pathways, supporting doctors, nurses, also dentists and pharmacists, but we didn't have a chance to go into that today. I want to build on what both Melissa and Rebecca said about being creative where possible, about remembering how important when working with these folks to acknowledge that they come with training and experience, that our country desperately needs their language and their cultural skills. And we as employers and consumers of healthcare need to be creative and thoughtful. Really the desire to understand what your demand is. None of these people want a handout. They want to work. They want to work in their field. They know, they see the want ads, that there's need. So how do we bridge from the supply to the demand and vice versa? And create great opportunities for employers to get really great employees, and for the immigrants and refugees who are in our country, who have work authorization, to be able to support their families and build on their training and experience. And I think that's it for us. Questions, comments, please keep in touch with us. We really want to build this work and, meet your needs.
Yeah, and we would love to just to parrot what Tamar said, we would love to actually engage with you guys if you have questions right now. I know there's also a potential peer-to-peer breakout session, which sounds amazing too. But if there are questions or ideas or comments, it would be great to hear from you and hear what might resonate, honestly.
Hi there. Is this okay? Awesome. All right. So I'm Jim Platt and I work in Minnesota and work as a job navigator. And I've been doing some pretty interesting interviews and meetings with different people, especially Ukraine. And one of the things that I have identified as a really big challenge that I think we are, as we get into this work more and more, we've got to start figuring out a crosswalk as far as we talked about the credentials on our side, but I think the credentials on the new people coming, new Americans coming to our country, what kind of education did you get? What was that all about? I've talked to a couple of different people, nurses, physicians, and the lingo that they use for a doctor may be different than what we call a doctor. A nurse might be different than what we would call a nurse. And so just developing some of that commonality of A, titles, and B, what the criteria was or is to getting to that qualification, that credentialing. Because it's a little cloudy and I'm using my United States / Minnesota / filter. And I'm looking at it and I'm going, okay, so is he or she a doctor, a nurse, and they have their own, they're coming from their set of expectations and stuff. And I'm just wondering if other people are running into this, because it would be so awesome if there was a magical book or, www website that, for interesting credentials across the globe type thing, I mean, we're going to have to come up with something like that, because this work is so amazing. And I'm kind of getting addicted to it, but it's also really challenging.
Absolutely. And that's why we have partnerships with the credentialing agencies who are doing that deep dive to understand education. I think we're also looking to understand, where folks are coming with, as you said, different training that doesn't prepare them well for our licensing exams. I think some of that's about having these pathways within healthcare where, Jim, I don't know exactly what you do, but I know I, as a coach, am not a healthcare professional. So I am not always the most equipped to evaluate those details, but, would love to help people get into healthcare settings where they're understanding. There's also a huge difference, I think, internationally, what it means even to be a nurse. That nursing
Right.
is perceived as a much less professional role. And so education around that is essential. So I would
Right.
love, I'm very happy to continue the conversation with you. My email is out there, but it is definitely an area of how we help people make those transitions and understand where they're sitting when they get here.
Well, and you're exactly right. And I'm kind of in a parallel role to you. But I mean, I was chatting with a person yesterday who is from the Ukraine and all the other stuff that goes along with that packaging. But, she described herself initially as a doctor of laboratory diagnostics. And I'm thinking, okay, those are three words that don't usually come together in a sentence. They did, and she knew what she was talking about. And I'm trying to unbundle that. I've talked with nurses that are, and again, I think we're all going to run into this more and more as we do it. And I think if there's kind of like a common data bank or dumping grounds of all this kind of stuff, we could start to sort it out. But I can only imagine, when we're talking with credentialing folks who are not exactly, people that, they all are pretty linear thinkers. And which makes sense. They have to be. They're credentialing people. They want every I dotted and every T crossed. But it's going to be a great opportunity for us. So thank you for letting me babble. But this is incredibly helpful and very valuable.
Thanks.
Just opening up, we have a few more minutes. If anybody else would like to unmute or drop a question in the chat, you may have also seen some chat activity from yours truly, dropping in some information around our healthcare community of practice. We're having a 101 session on April 12th. Highly encourage that as a space to continue this conversation and many others. And then I also dropped our registration link for our next session on April 20th that will be looking at having some folks from our local, not local to me, but Boston area, sharing some insight and information around how to leverage local partnerships in retaining and attracting your different populations of need. And then also the evaluation. Please be gentle with our technology difficulties, but I hope the content was what met your needs for today. I apologize for us not being able to have the breakout sessions today, but it felt much more important to have this content delivered to y'all, and we will continue to figure out ways to keep the conversation going among peers. But one last call just to see if anybody else has any questions. I know Joy had a few in the chat. I hope you got all of your answers. But this is, another opportunity to ask some questions if anybody has them.
I have a question if no one else does.
Please, Tom, bring it.
Rebecca, Tamar, this was fabulous. Thank you so much. I am curious, Rebecca, you mentioned early on how your organization is experimenting now with AI to address some of these job matching issues. If you see that as having potential for addressing some of the issues that Jim brought up, especially in terms of recognizing skill pathways and credentials that we may not have the right language for here in the US.
Yeah, yes. And also in the end, a lot of this has to do what's in Tamar's brain after having worked with hundreds and hundreds of people is simply not easily there's no AI is going to be as smart as Tamar and I have for a very, very long time. But actually, the hope is that AI is able to, so AI in hiring has gotten a bad rep, correctly so, for excluding people who have diverse or non-traditional backgrounds. And so kind of the fun thing here is to try to see if we could actually use AI to do the opposite, to like uplift people who actually are qualified, but who you wouldn't normally be able to see. In order to do that, we need to train the systems to do that. So yeah, we're experimenting with a group called Future Fit AI that has a product on the market that they're using in workforce, but not with immigrants and refugees. So they're going to try to learn on our people, and we're going to have to correct them. We've already seen that. I think they, one of the first experiments, they recommended that someone who is a professional in finance or something go into like cooking. So not yet there, but the potential, I think, long-term to move in that way. I do think the credential agencies, and actually Upwardly Global has relationships with a lot of those credential agencies. So folks who come via us can often get those credential evaluations for free. Just like they can often get skilling for free, like we're able to support those types of partnerships. And those agencies do deep dives into what is equivalency that, no AI system will really be able to do. They won't be able to verify, for example. But yes, I think there's some opportunity for them to be able to pull out what skills are you talking about and how can they plug into the skills that are needed without us looking at what the titles are necessarily, or looking past and beyond the titles. And that skill-based hiring is the name of the game for lots of other non-traditional hiring opportunities as well. So I think definitively, yes. And it's interesting and exciting opportunity, but it wouldn't replace, like, I think if any one of the healthcare professionals on the phone right now wanted to say, okay, we want to do a little program where we're going to try to do this. We're going to have 5 slots and we're going to see what we can do. I actually think that way of learning and getting stuff done, doesn't need to wait for any AI system to learn. And I think that's why partnerships with groups like Upwardly Global, who really deeply understand who the talent is and what their strengths are. And then if we have employers who understand what their needs are, and we have people willing to play and think creatively, I think we can actually make amazing things happen without too much overlay. And I get excited about those opportunities too.
That is super fascinating. Thank you so much for sharing.
Yeah. Well, again, we're very appreciative to have had the chance to share with you, and I hope that we'll be able to work with all of you and with Melissa and Tom and the National Fund more in order to make some of this stuff move forward. There's the need and there's the opportunity. So it's just about figuring out how we can connect. Thank you.
Yes, so appreciated. Please, everyone else who remains, just join me in a little round of applause and thank you and gratitude for our presenters today. Really appreciate the information that you shared and the wheels that y'all got us turning. I can feel it. I'm really excited to see what happens next. So we will all absolutely be in touch. And once again, thank you all to everybody on the line for carving out some time of your day to be here for this content. Really appreciate you all and hope to see you at the next one.
Thank you. Let's stay in touch.
Bye.
Bye.